Women's health means like we're preventing others from getting STDs and trying to help them know what's around the world.
Women's health means to me that she's going to be able to be successful during her high school and later on in life, also knowing about her body and how she can control it and like not let someone else take control of it and what she can use.
I know she said it's alright, but you gon' make it up next time. I know she knows it's not right. There ain't no use in lying.
The Young Women's Health Leadership Program focuses on female-specific health issues with the goal to provide awareness and information, including but not limited to emotional, mental, social, and physical health. We have met with local legislatures to advocate our policy platform on initiatives not only that affect us, but our communities as well.
Being healthy mentally, physically, emotionally.
It pretty much always means no. So don't tell me you might just let it go. And oftentimes
I feel that youth are critical in giving us input about what they want to do, how they want to do it, when they want to do it, where they want to do it. If they're involved in the planning, if they're involved in the execution of a plan, if they learn something from the plan, then I've done my job.
Sunrise no longer sees it with her sleeping eyes, and I know that when she said she's gonna try, well, it might not work because of other
Maybe a lot of teenagers are not involved in any activities and they get bored. And
the problem comes with not enough education and resources. If youth aren't educated on the topics on how they can receive free birth control, on what sexually transmitted infections are and how they can be transferred, they're not going to know what to do, and then they're going to be affected by it. So if the education is increased, then pregnancy prevention and STIs would decrease.
I'm most concerned that young women have access to good reproductive health care. That's the primary goal that I'm after when I work with young women. I want them to understand sexually transmitted infections. I want them to understand pregnancy, how it happens, what the choices are. I want them to understand dating and rules about dating. I want them to understand violence in dating. I want them to understand that their body is their body, that they have a responsibility to themselves, and that for those of us that are older, they have to do some education of us as well around their skills, their abilities, and their ways of thinking.
Why do you think it's important to involve youth in addressing these issues?
So other girls would have the opportunity to actually learn from those women, as I learned from my sisters previously that were young mothers, and I learned that maybe that's not the best way, and I saw the struggles they went through, so I'm able to change that and turn it around and actually teach others from my own personal experiences in my family.
harder that you try, baby, the further you'll fall. Even with all the money in the
and that you can volunteer at Cal Casa and, help and get internships. So that was really good.
I hope to meet the legislative people, if possible. Arnold Schwarzenegger.
You're gonna have to change. You're gonna call it by a brand new name. Ooh. Please, please, please don't drag me. Please, please, please don't drag me. Please, please, please don't drag me down.
There's a lot of teenagers getting pregnant, just going around, and they don't even know if their partners have the disease, and then they're finding out, and then they start crying, and it's basically their fault for not listening to the parents and all that.
Please don't drag me down.
In an ideal world, every teenager would have adequate sex education that is comprehensive, that is bias-free, and medically accurate. However, the reality of the situation is that 1 in 4 teenage girls have a sexually transmitted infection.